My research question is, can using stem cell therapy help women with Asherman syndrome regrow enough healthy endometrium to begin menses? Asherman syndrome occurs when interuterine or intercervical adhesions grow, and they either cause hypomenorrhea or amenorrhea, which is the very light or the non existent menses. Asherman syndrome can occur from physical trauma like a DNC or an IUD placement, or from infections such as genital tuberculosis or pelvic inflammatory disease. The normal treatment for Asherman's is a hysteroscopy followed by some estrogen and progesterone therapy. And this is performed with a scope inserted, and they lyse the adhesions and then place a Foley catheter balloon or an IUD to keep the cavity open while estrogen therapy is combined for 3 weeks, and then they remove the balloon and stop the therapy to see if menses restarts. This study was done in New Delhi, India, with 6 women, and 5 of them had developed Asherman's from genital tuberculosis and 1 from a DNC. Study was done over the course of a year, and the women ranged in age from 25 to 35. The women were also given pre-study physical exams to make sure that their very light or non-existent menses were due to Asherman's and not some other cause. And they were also women who had failed the previous treatments for Asherman's. The hysteroscopies did not work for them, and the estrogen therapy. So this was a final attempt for them to regrow healthy endometrium. So they aspirated the bone marrow from the patients, and then they separated the mononuclear cells and combined them with, tagged them with CD34 antibodies, and then they injected the stem cells into the women's subendometrial zone between the endometrium and the myometrium. And then they were also given estrogen and progesterone therapies. And after 3 months, there was an increase in healthy endometrium, and all of the women developed menses. And at the 6-month marker, one of the women had dropped out of the study and they couldn't follow up with her. But the other 5 ranged in thickness but still had menses at 6 months, and the same went for 9 months. Some had increased in their endometrial thickness and some had decreased, but it was still enough to give them menses. And that was statistically significant considering that the menses was brought back for all 6 of the patients with this stem cell treatment. The critique I would have for this study is that it was such a small population of women, and they were all Indian women, and the way they had gotten Asherman syndrome was through genital tuberculosis. It'd be interesting to see a much larger population and maybe a variation of those that developed Asherman syndrome in various ways, such as DNC or physical trauma and maybe other infections, and see if it worked for them as well. Having had Asherman syndrome myself, I was diagnosed after a post-delivery hemorrhage 3 weeks after I gave birth to my first son, where I had a DNC for retained products and placenta, and I developed Asherman's a month later. And for 9 months, my doctor could not figure out what it was. And I finally had a laparoscopy, hysteroscopy, where it showed that my uterus was scarred shut and that I had Asherman syndrome. So I developed that postpartum. And it'd be interesting to see if the healthy endometrium can grow thick enough for women to actually sustain a pregnancy. I know that it's very difficult for women with Asherman's to get enough endometrium, not only to get a period, but to have a thick enough endometrium to actually become pregnant and sustain a pregnancy. That would be an interesting follow-up to follow up with a larger population and a more diverse population. But overall, I felt that this study was a great representation and provides great hope to a lot of people that suffer from a very painful and debilitating disease that leads many women to never be able to have children. That's it. Thanks.